discussion? Hearing none, then all those in favor signify by saying aye.
Aye.
Any opposed? The motion passes. We have no unfinished business. We have new business tonight, the fire and EMS study and staffing plan update, and that is going to be presented by Chief Mondor. Welcome.
Thank you, Mayor, members of the council. If I could have the slides, please. At the June 27th, 2022 City Council workshop, I presented a fire department update and staffing plan and considerations. And now I wanted to come back and provide an update with some updated changes and opportunities that have been presented. The purpose of tonight's workshop is to review the history of fire department response, the current state, and future considerations. Just a little bit about who we are. Part of our mission statement is that we exist to serve the community's needs, and we do this through fire and EMS reduction initiatives, emergency response, community engagement, training, and preparation. And each of those pictures represents a small piece of what we're doing in the community. We talk about this quite a bit in the fire department, but we are not an episode of Chicago Fire where we're sitting around waiting for the next call. So it's not the fire department you see on TV. We're engaging the community. We're out there doing proactive measures. We're guided by a strategic plan that supports the city's overall strategic plan. And while a majority of tonight's presentation will be focused on the fire and EMS demand, the calls for service, I just want to highlight the other things that we're doing: the community outreach, unsheltered outreach, fire inspections, code enforcement, our community paramedic program, part of the mental health outreach team, fall prevention, training, and then being first in employee development and wellness. Some background and history. In 2011, the department transitioned to a duty crew part-time, full-time staffing model, and that was when the paid-on-call model was formally sunsetted. Due to some increased demands and just trying to understand the nature of the services delivered and what the future looked like for fire and EMS in the city of Maplewood, a fire and EMS work group was established. That work group consisted of 5 citizens, members of city administration, staff, and department administration, and helps to inform the future of the fire department. Part of that, some of those recommendations was to conduct a fire station location and operational review by a third party. In 2017, Fitch and Associates completed the fire station location and operational review and came up with a series of recommendations, which I will discuss. One of the key recommendations was to transition to a full-time staffing model, which we did in 2018. Another one of the key recommendations was to consolidate from our 3-station model to a 2-station model, which we executed in the summer of 2022. As we continued to grow and as service levels continued to increase, part of the June 27th presentation was to address what's called the relief factor. So our margins were too thin, which meant that there was increased amount of mandations and a decreased ability for us to absorb people that were away from work for sick reasons, FMLA, vacation, etc. And so City Council authorized the addition of 3 full-time staff to address that relief factor. Reviewing the Fitch study, completed in 2017, it was a robust document that followed 6 to 8 months of research and a lot of data analysis. That study reviewed community response history, community demand, historical department performance, what were our response times, what did the future look like, alternate staff schedules, station reliability, the simultaneous events. We reviewed the viability of public and private partnerships, station locations, resource deployment, and ultimately Fitch provided a series of recommendations to City Council in January of 2018. A part of what you're going to see tonight, and it was highlighted in June, but the data analysis that was used to inform the Fitch study was from 2014 to 2016. And during that time, when you average the 3 years, we were averaging 5,130 calls per year, which is just an important consideration as you look at some of the existing data today. The summary of Fitch's key recommendations are listed above. We transitioned to a full-time department. They provided several alternatives for staffing, which I'll discuss. We've now reallocated resources to the North Station. They recommended a peak load ambulance, some increased supervision, reorganization of the administrative structure, and delaying public-private partnerships for EMS. Some of the key actions that in 2018 from City Council were to adopt an 8-minute travel time for system performance. What Fitch found was that was close to the historical performance in the previous years based on their data analysis. And they recommended that council adopt that 8-minute travel time. And travel time means the time that our vehicle is en route to on scene, so that we're just making sure that we're not manipulating any data. That means when wheels are moving and wheels stopped for the part of the response time. City Council also adopted recommendation 3 of the 5 staffing options at the time. The actions that we've taken, like we've talked about, we transitioned to full-time staffing model, have now occupied the new North Fire Station, admin structure was reorganized, and the administrative assistant position was moved to full-time to support department operations. And so you can see, based on the recommendations, we've completed most of these. We did deploy a peak load ambulance for a short period of time. When COVID happened, we made the decision to turn that into a 24-hour response unit instead of the peak load unit with the existing staff. So we didn't add staff, we just restructured some things, and that's how we operate today. And we have not added a battalion chiefs, but we do have added captains that address that increased supervisory need, and we did that in 2022. I'd like to talk a little bit about the current state, and some of the considerations that we'll talk about with council are just the run volume trends and the system performance. So how are our fire EMS resources responding to the demands that the system creates? This slide represents our call volume since we transitioned to a full-time staffing model. And that's why I discussed the 2014 to 2016 data. That was 5,130 calls on that 3-year average. And now in 2022, we responded to 7,570 calls. So we've experienced nearly a 48% increase based on the analysis conducted by Fitch, and a 23% increase since 2018 when we transitioned to full-time. This slide highlights changes in staffing over time. In 2011, which happened to be the year I started with the department, we were staffing a minimum of 6 people today. And just for context, it takes 2 people to staff a resource, a minimum of 2 people. So if someone gets sick, we need someone to drive the ambulance and someone to be in back. If someone's on a fire truck, we need someone to drive and someone to do the activities outside of the fire truck. So as volumes have created, we've made some movement in minimum staffing, but we've essentially added 1 unit over those past 11 years. I'm a visual person, so this kind of helps me understand what we have for resources in the community and just a better visual representation. On the left of the slide, you'll notice that's the North Fire Station resources. So we have an engine, a medic, ladder company. So if the fire call comes in, they'll hop on the ladder truck. If an EMS call comes in, they'll hop on the ambulance. And then a standalone ambulance unit. And then at the South Station, we have 2 people that are assigned to a medic engine company. Same thing. If a fire comes up, they'll hop on the fire engine, and if an EMS call happens, they'll hop on the ambulance. And like I had mentioned, it requires a minimum of 2 people to operate those resources today. This slide highlights the system performance since 2019. We report this in Invisio quarterly. And we've not historically been able to meet that goal of the 90th percentile, 8 minutes or less. And the reason we use 90th percentile is it's a more reliable measure than averages. So this means that out of 9 out of the 10 incidents, we want to be there in 8 minutes or less. If we just used averages, a very small response time, meaning we're across the street and it takes 30 seconds, or a very long response time can sway the data. And the 90th percentile has been a more accurate measure and is an industry best practice. As you can see, we were hovering around being able to meet our benchmark in 2020. You can see there was some reductions in call volume, and that was predominantly due to COVID-19, the second half of 2020. But we were getting close. As call volumes continue to increase, our compliance or ability to meet that threshold has continued to diminish. In 2017, presented to council in 18, Fitch and Associates projected that we'd be approaching 9,000 calls by the year 2025. We've stuck pretty close to that tracking throughout the history of time. And our current forecasts have us anywhere between 8,600 to 8,900 calls in 2025. So their analysis has proven year after year to be accurate, and we continue to analyze that every year moving forward. That's the quick data analysis. I just wanted to pause there and see if there's any questions about the data before we get into future considerations.
Councilmember Juniman has a question.
Thank you, Mayor. Did you say that response time is from the time the wheels start to roll until they stop?
That's how we report it to City Council as part of the overall
Okay.
response time continuum.
So it is or is not then affected by gaps at dispatch?
It absolutely is from an overall response time continuum. That's another way we measure
Yeah.
overall response time. This is what Fitch recommended, because this is the part of the response time that we have direct control over, is
right.
when the wheels start moving and when they stop moving.
Okay.
The external factors such as dispatch, we do monitor that, but report based on this metric
Got it.
to compare to historical performance.
Because they're having similar staffing problems. Actually, they're having severe staffing problems at the moment. And so that's bound to affect everybody who uses it. I mean, one person can just answer so many calls, in a minute's time. Then they're doing everything they can do to get more people. But the reason I bring it up is because I just had a meeting last week, dispatch policy, and they pointed out to us that their time is not where they want it at the moment either because of lack of personnel.
Correct. Yeah, we monitor that time. We monitor our shoot times, we call them. So how much time does it take for them to get to the apparatus when they're in the fire station, and then the travel time. But that's the most reliable metric of the things that we can control. And as long as they don't dramatically change the road network, it's going to be reliable over time to measure against historical performance.
Thank you.
Thank you. Go ahead.
Okay. So with that, we discussed 3 steps at the June 27th, 22 City Council workshop. Step 1 was addressed in the 2023 budgeting process. Step 2 is to consider adding an additional response unit. This unit would address increased call volumes and also would add a resource to the south end of the city, which I'll highlight in some of the future pictures. One consideration is our ability to meet that response time benchmark. Another consideration is that Maplewood's geography adds some challenges when it comes to emergency coverage. We're not a square, and so when we try to reliably staff resources, this is a consideration that we take into account. So right now, there's 1 2-person unit. This added unit would be added to the South Station, which would increase reliability and the ability to get additional personnel on scene for more complex incidents without having to wait for a unit from another station. And then step 3, Fitch had recommended that City Council consider 3-person staffing at each fire station, and that's baseline readiness levels. As volumes increase, we continue to try to lean into best practices regarding staffing, specifically on our suppression or fire vehicles, and try to lean into those best practices. And having 3 people would allow us to take quicker initial action and impact higher risk incidents and allow us some more operational flexibility, which I'll cover in future slides. We'll talk about with these steps kind of a good, better, best approach. We acknowledge that all of these require significant financial investment, and are not blind to the fact that there's several other commitments that the city needs to make financially. We just completed a compensation study. There's a bunch of other city priorities that we're not blind to. And also part of my job is to make sure that we're trying to continue to meet the needs of the community now and into the future, which is why I'm here tonight. So the good scenario would be baseline or adding a peak unit 12 hours a day. So in the slide, in the hours of 7:30 in the morning to 7:30 at night, we would have an added unit for 12 hours of the day. This also highlights kind of a phased approach. I'm going to talk about some grant considerations, but also want council to consider, if we don't get the grant, how can we phase in some of these changes more reasonably over time. While this would add to a unit during our peak call volumes, you can see that at 7:30 at night, that unit would be pulled out of service. So it would no longer be available once that unit is pulled at 7:30. Good. Option 2 would be to add a 2-person unit 24 hours a day. That would require 6 FTEs. And it just adds that overnight coverage and reduces the changes in the daily staffing to our units. Better scenario is 9 total FTEs. This lends itself to the Fitch consideration that about the 3-person staffing allows us to better assemble workforce or initial action crew when responding to emergency incidents. It also creates added response capacity. So for a car fire example, right now I have to send 2 units to be able to attack that car fire. With a 3-person staffed engine, I wouldn't need to send multiple units. I could just send the 1-person or the 3-person engine, which would reduce the amount of overall units that we need to send to more complex emergency incidents. The increased abilities also better meet OSHA, or Occupational Safety and Health Administration, and National Fire Protection Association standards as it relates to our effective response force for emergency incidents. Best would be 12 total FTEs. This builds on that 3-person scenario that Fitch had recommended we consider, and would ensure that there's a 3-person company at both the north and the south fire stations, which is a more equitable and consistent approach across the city. I summarized each of these steps in the following slide. And the table represents good, better, and best, and what the total impact the total impact would be. Good, it would be 4 to 6 FTEs, so a 12 or 24-hour unit. Better would get us that 24-hour unit plus 3-person staffing on one of the units in the city. And best would get us that 24-hour unit plus 3-person staffing both north and south. We talked about this at the June 27th meeting. And in preparation, we've been prepping in the background for the SAFER grant, or the Staffing for Adequate Fire and Emergency Response. Unfortunately, they don't tell you when it's going to be opened each year. They just post a notice, and you have about 7 days of advance notice that the period's going to be open for the next 30 days. So we have been preparing data, analysis, narratives in anticipation of this opportunity, but it did just open and it closes on March 17th, hence the timing of this presentation. This grant funds 100% of positions for 3 years after award. They had stated that their goal is to notify all departments by September 30th of 2023, whether or not they got the awards. And in this scenario, the city's financial commitment would begin in 2027. Also just want to highlight that the grant is not guaranteed. We recommend that we apply for the grant, and there will need to be additional staffing discussions regardless of the grant. But we think that this presents an opportunity to better address needs now and into the future, with also allowing us to better plan financially for the impacts that would be associated with any of the recommended changes. With that, I would open it up to any questions and thoughts from the council. With the SAFER grant, We would not apply, obviously, for a grant without council support. There needs to be a commitment after the grant period to ensure that those positions are sustained. From a recruitment or retention standpoint, we can't guarantee. It's not a best practice to say you have a job for the next 3 years. And so philosophically, I believe that getting council direction and support for where we should lean towards these good, better, best recommendations would be helpful in informing our grant application to make sure that it's most competitive. Thank you.
Thanks, Chief, for your presentation. I want to commend our staff for the way that you have been working to be very intentional, very methodical in implementing the Fitch study. I think that we have really done a remarkable job. I know in my conversations with other mayors who are also going through changes with their fire departments, some of them have not been quite as intentional and as methodical, and they have had to absorb some very big changes in a very short period of time, and that's always hard to do. So we have been, I think, at the recommendation of our staff, we have been slowly chipping away at this and implementing what really has turned out to be a very good recommendation and study for our city. I had plenty of opportunity to review this, and I also had some time to meet with the chief or to talk with the chief about this. And I think it's pretty clear with our aging community, with our increase in medical calls, with just the increase in calls that we are experiencing, that we have to add fire employees. We just know that. And so in looking at this, I'm going to just say right off the bat that I support going for the grant. I think that it's another step in us being very intentional. If we could, certainly, our staff has been very successful at getting grants. And so I'm going to be optimistic about that. But in terms of going for the grant and trying to get a grant to hire 12 so that we can implement at the best level makes, in fact, the most sense to me, because I don't like those numbers dropping off because our call volume is going up. We know we have to add staff. We are adding 3 this year, but I think that this gives us an opportunity, and with the help of our finance director, if we were to get the grant, correct me if I'm wrong, if we were to get the grant for the 12 new staff members, the grant pays for the staff members for 3 years, and then we would have a period of 3 years to figure out what we need to do to incrementally make those changes. Once again, I think being very intentional and very incremental so that we can be prepared in 2027 because we're going to have to add staff anyway. So this just seems to me to be the best way to do it. So I would support going forward with the best proposal and seeing if we can get the grants. And then if we don't get the grants, we'll know, fortunately, by the end of, by September, we anticipate we would know. And if we don't get the grants, in my mind, then we would be able to implement, maybe at a slower rate, 3 per year for the next 3 years. We're going to have to do it. We know that because we want to make sure our residents and our businesses are safe. And this just gives us a really creative opportunity to get these grants. Tell us a little bit more about where the grants are coming from, and then I see our council members have questions too.
Thank you, Mayor. Yes, the grants come from the Federal Emergency Management Agency, FEMA. I just had one in the FYI. We got one through a different leg of FEMA through the Assistance to Firefighter grants. But each year, federal government funds large, hundreds of millions of dollars to local jurisdictions to help increase staffing levels, to have more adequate staffing levels in their community, and then to support other operational needs. So it's a federal grant program. It is extremely competitive. But we've been working diligently for the past 6 to 8 months to make sure that everything in that grant is going to align with industry best practice and try to make our grant as competitive as possible.
Great. Councilmember Juniman, you are next.
I agree. I think we need to put our money where our mouths are. You don't get to at this stage of the game saying, okay, we're done now. We're just going to play with what we have. That doesn't work in this business. And we have, I think, a fairly solid history of supporting our public safety. And we went through this grant thing also with the social workers, and we have said we are committed to that in combination with both you and the PD. So if we're going to keep up with the times and guarantee people a safe environment, you don't get to not do what needs to be done. We just have to find a way to do it, and sometimes that means not doing other things as rapidly or something. Been here long enough to know that. But the fact that we have staff in almost every department looking for grant money has helped us many times, too, with other projects in other areas. And we get a lot done that might not be done otherwise. So I'm hoping we do get this one, but I also think that every department has staff who's vigilant, and so they're helping us too. But the short version is we need to put our money where our mouths are.
You know, one other point, it's really interesting to me how accurate Fitch was in terms of projecting our projected calls for service. And one thing I would just remind council members, you know, they have been very accurate about that. And we're going to have 9,000 calls by 2025. And we need to be prepared for those 9,000 calls. So, Councilmember Lee.
That's definitely the big point of it is the datas don't lie. This is really, it's here, it's real. You know, it's happening in our community. Our community is growing, and you know, I do not also want to say, you know, thank you for the hard work that you guys are doing. Door knocking and talking to community members. You know, it's really a matter of life and death when it comes to these type of situations. So we want to be as prepared as possible as a city. One of my questions to you is, I see that you have it's 100% funded for the positions for up to 3 years, but then the cities would have, our city would have to then begin to pay for these firefighters starting in 2027. Is this not a renewable grant then, or?
Councilmember Lee, correct. It is not renewable.
Okay.
After the period of performance, the city does have to take on that financial commitment. Okay. And there are communities, larger communities throughout the United States, that if they're at risk of laying firefighters off due to budget cuts, this grant can also help fit in that area, but it's not allowed to renew those added positions after the 3-year period of performance.
Thank you for that.
Thank you.
I'm also on the same boat, in full support of this. The money is out there. Let's go get them. And I would imagine that in 3 years, there will be other opportunities that we can tap into, grant opportunities that we can maybe look into to help fund this for the future, too.
Thank you.
And I'm sure during those 3 years that you will be having many meetings with Mr. Rube about how we are going to fund it once we get past 2027. But the fire calls are going to be there anyway, and we have to make sure that we've got people to respond to it and that we've got equipment to respond to it. So I really appreciate the way that you are